Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this gray, rainy day. In studio with us today is the director of the Jean and Barbara Burnett Burn Unit here at the Health System, Dr. Dhaval Bhavsar. And out at the Olathe Fire Department, Fire Marshal and Assistant Chief of Community Risk Reduction, Mark Wassam, is standing by along with perhaps, I'm not sure if we have that or heard, the Public Education Specialist, Michelle McLean, on as well. Today we are R-rated, or at least PG-13. We're going to be blowing stuff up again. We started using it yesterday, and we're going to use fireworks to blow up fruit and burn hot dogs to illustrate the danger of those fireworks. We want to remind you that these folks that are doing this are professionals. So don't try what we show you at home. Don't go blowing up watermelons, etc. This is for demonstration only. Okay, but before we get to that, Hawkeye, you're back on the road again. There's a Willie Nelson song on that. Do you know that song?
Oh no, he's going to sing.
On the road again, I can't wait to get on the road again. Making music, playing soccer with my friends. Oh, I can't wait to get on the road again. Your son's playing soccer, is that right?
Yeah.
His tournament went pretty well?
What's that?
His tournament's going pretty well. I understand you're like at some big final or something out in St. Louis. What's going on with that?
Yeah, it'd be good to get home. I drove from Denver to Kansas City and then Kansas City to St. Louis all yesterday. So I got a good little I-70 stretch there.
Yeah,
he
on
is
the road
in
again.
The Midwest Regional Championships for the 2006 or the U15 boys with his team. So today's the semifinals. So if they lose, I will be back in studio tomorrow.
Okay.
And if they win, I will be doing the show from the same place I'm doing it right now. So
awesome. Well, congratulations to your son. I guess that he got vaccinated and he's still playing great soccer. Pretty good stuff.
You know what? That was a point I was going to make. You know, he's able to do this now because he is vaccinated. So I'm not concerned about pulling him out for any missed participation because of any quarantining or circulating coronavirus.
Yeah, we're going to come back to that question in just a minute because lots of stuff kind of going on around the Delta thing, and now the Delta Plus out there in India too. So how do we do overnight?
And I would just like to say before we get to that you know, a lot of his teammates and their older siblings were vaccinated prior to all of this, so that is another good thing. Most of his team is vaccinated.
That helps.
How are we doing? You know, we at the health system have 13 active patients with 5 in the ICU, 4 ventilators, and 1 on ECMO. Still 8 the additional recovery period patients, so 21 total. Hays has 1 active patient. But I would also like to say our last death at the health system was June 19th, so that is a very good thing. But as you can see, we still have very sick patients requiring ventilatory support and, of course, ECMO.
Yeah, that ECMO thing is going to be tough. Hopefully that'll end up going okay. So a lot of big news. So first, the World Health Organization says, I don't care if you've been vaccinated, keep your masks on. What do you think?
Mm-hmm. Yeah, you know, again, the World Health Organization has to speak to the entire world. Not every country is as fortunate as we are here in the United States. But again, just like the CDC, their main concern is the general public health. So I understand people now will probably use this as further division about what to do and what is right. And, you know, we, meaning medical or public health professionals, don't really know what's going on. Coronavirus is a complicated issue. We know the devastation that it's caused, the morbidity, the mortality. All of the countries aren't as fortunate to have a surplus of vaccine as we are. So there can still be a lot of spread out there, not so much if you're vaccinated, but for those unvaccinated populations around you in those other countries, in those other geographic regions as well.
Yeah, I think that's the key, right? The World Health Organization is not going to try and parse this into small bite-sized chunks for every county like we do in the United States. They're just going to say, look, here's a recommendation for the world, wear a mask. Interestingly, there are some countries that are, go ahead.
No, but I was going to say, but it's like you and I have always said, it's about identifying risk-benefit. And this is a Swiss cheese model as well, although the vaccines really block up a lot of those holes from the Swiss cheese and are extremely effective at giving protection. There are still those non-pharmaceutical interventions, and you can still weigh those risks and benefits of anything that you're doing and still continue to mask if you would like, and distance, and do things outdoors, and all of those things.
So, Hawk, one way to look at this, too, is just to see, reflecting around the world, Australia, Israel, other countries are saying, we're going to start going back into lockdown mode again because we're having more infection spreads. I think Israel's going back to masking indoors. I think Australia's and other countries are saying, Malaysia and others are saying, we're going to go back into more of a strict lockdown mode because this Delta virus is causing trouble and we don't have enough folks vaccinated.
Yeah, absolutely. Nobody wants lockdowns, but we do understand that adding restrictions does help reduce the spread of the disease, as does the masking, as does vaccination. Would Springfield, would that be a good candidate to have increased or imposed restrictions? It might be, understanding the devastation, the capacity issues that are happening right now in that geographic area. Just looking on a website today, covariants.org, looking back in late May, in Kansas and Missouri, the Delta variant was about 10% of the sequences that they were able to identify. But now if we move to today, it is anywhere from 65 to 75% of the variants that are sequenced in Kansas and Missouri. So we know the Delta variant is quickly becoming that prevalent isolate.
And we keep saying to people, it gets into younger folks too. All these kids are going to be getting Delta variant. And so I think the risk is especially to those unvaccinated. There was one article today in the New York Times I was looking at that was talking about the rise of the Delta variant. What does it mean for the United States? They were pointing out that some states with very low vaccination rates, like Missouri, may have to be thought of more as a country where they're having to go back into lockdown mode. Now, Missouri resisted that the whole time, but this Delta variant could really wreak havoc, just as it is in Springfield, Missouri.
Absolutely. And early data from Scotland does show that there is a increased risk of hospitalization from the Delta variant. I think it was 1.85 increased risk, and these are, like you said, affecting younger people. But in the same vein, there are research articles out now showing that AstraZeneca and the mRNA vaccines all provide good protection against Delta variant. So vaccination continues to be the way that you can protect yourself and your loved ones.
Although interestingly, they kind of push that you need a 2-shot regimen, not a 1-shot regimen for this, and meaning that the J&J vaccine may work, but they were saying that after the first dose of the mRNA, you only get some, but you really need that second dose to be really effective against the Delta variant. So that's just another thing we have to think about, and how that will affect us going forward. All right. So let's see if there's any reporter questions online.
Good morning, guys. Taylor, Channel 41. How are you this morning?
Hey, Taylor. How are you?
Taylor.
Good, thank you. I want to touch on that topic, Dr. Stites, you were just talking about with J&J and the Delta variant. I was looking at an article right now from CNN from yesterday where they quoted their medical analyst, Dr. Jonathan Reiner, and he said, we have 2 very effective vaccines against the Delta variant, and if the Johnson & Johnson vaccine is significantly less effective, then we should stop giving it. I just want to ask your response to that, and really if you could talk more about how Johnson & Johnson stacks up against Delta right now, especially when we don't know as much as we do about the other vaccines potentially. Yeah,
Hawk, I would say we don't know a lot about the difference in terms of just the J&J vaccine. I'm really anxious to see what happens with their 2-shot data should be coming out in July. But in my personal opinion, I like the mRNA vaccines a whole lot because I like the 2-shot stuff. I like the efficacy data. I like the long-lasting immunity that the 2-shot regimen appears to give us. So I'm a little biased that way over a 1-shot regimen. We need more information, though, about the J&J and the Delta variant, and now this Delta Plus variant that's coming out of India. What do you think?
Yeah, exactly. We know the vaccines. We really equate the Pfizer and the Moderna vaccines to each other. We have been somewhat equating the AstraZeneca and Johnson & Johnson vaccines with each other because they are both those non-replicating viral vectors that have that spike that we make that antibody and that immune response to. Interestingly, also in that Scottish paper about hospitalizations and risk about the Delta variant, they also do provide, however, that both the Pfizer and the AstraZeneca vaccines do provide very good protection against hospitalization for the Delta variant as well. So just as you said, we're learning more and more about the Johnson & Johnson vaccine, but hopefully that is an indication that Johnson & Johnson's also providing better protection. The guidance is not to mix dosing or get mRNA vaccines after you had Johnson & Johnson vaccine. But overall, if that were to happen, I certainly believe it would be safe. I don't think you would have really any ill or adverse events from mixing those doses and getting that. But right now, there's no guidance to get a separate vaccine dosing if you've already received Johnson & Johnson.
Yeah, not yet.
That was going to be a follow-up question for me.
Please.
I was going to ask because, as you know, we had the large Arrowhead vaccination event earlier this year that was the Johnson & Johnson vaccination event. I mean, of the thousands of people who were vaccinated that way during that event, should they be considering doing something else with the Delta variant news right now?
I think they ought to be making sure that they follow the recommendations closely, because I think we're all watching this very question. The AstraZeneca vaccine and the Pfizer vaccine, I think in the Scottish and the British evidence, still suggested you needed 2 shots, not 1 shot. Was that right? Is that right, Hawk? Because I know that's recommended from other data for the Delta variant. You needed both shots to really get protection. The question I have in J&J is the efficacy after 1 shot is not what it is after Pfizer or Moderna. 1 shot, actually, nor 2 shots. And so even though it's still extraordinarily high, remember back at the beginning of the crisis, we would have taken a 50 or 60 or 60%. I said, that's great news. And J&J ended up around 68 or 70. So it still had good data. But man, this Delta variant would spook me a little bit. I don't think I could recommend to a patient. I have a couple of my patients I'm staying in contact with. One of them's had a transplant, and they asked me, should I get another vaccine? I've only had the J&J. Should I get another shot? I'm not recommending another shot yet, but I'll tell you what, looking at the data real closely to watch it and see. And as far as mixing the vaccine, I suspect we're going to end up that you can mix that vaccine. What do you think? I know we can't make that recommendation officially, but there's some emerging evidence that suggests that it's probably going to be okay to mix.
Yeah, I agree. I think the safety is going to be there. We've heard those anecdotes. There was that one woman who actually received 6 doses all at one time. A full vial of vaccine for the mRNA. They watched her in the hospital for a couple days. She did well. I know other people who have gotten trial doses of AstraZeneca or Johnson & Johnson when the trials were opened up. But then when there was the emergency use authorization of the mRNA vaccines, they ended up getting those full dosing. We know it's safe. So I think the safety is going to be there. I think we are going to be looking at the efficacy and really the need. But again, right now, there's no guidance to add doses or add vaccines on what you've already had if you are fully vaccinated.
So, Haka, like me, if you had one of those transplant patients or somebody who had the J&J vaccine you're a little concerned about, would you recommend to them now to go get an mRNA vaccine? Because I've not done that yet.
Yeah. That's hard. Again, no guidance to do that. I think there is more information coming out about those immune suppressed patients needing extra dosing, even of the mRNA vaccines. So I'm not going to say that it's a bad idea to do that. I certainly believe it would be safe. But the new data suggesting that even with the mRNA vaccines, you probably need a 3-dose regimen at least to mount a detectable antibody response. So I think that's coming down the pike. Again, there's still no other guidance from the transplant physicians or the transplant society that I'm aware of, but I think they are probably moving in that direction.
Yeah, I think that's right, and I think, I bet they will come in that direction. As you cited, there was a New England Journal of Medicine discussion under correspondence last week that mentioned the efficacy of a 3-shot regimen. It's a small number of patients versus a 2 or 1-shot regimen. So we'll see. So Taylor, here's my direct answer to the question. At this time, I would not recommend a follow-up dose to J&J. However, I watch it every darn morning, and I would continue to do that and say to you, by this time next week, building the airplane while we fly it, I may change that answer. But right now, I can't say yes to it, although I'm probably moving that direction. Other questions out there?
Don Pittman with Channel 9 has two questions today, and they really are two questions. The first one has to do with the Delta variant on the Missouri side. How concerned are we about what might happen on the Kansas side? Because we know there are neighbors and people cross back and forth.
Yeah, I think the Delta variant is throughout the United States. It's not in one state or another state. It's just been more talked about in Missouri because of the Springfield issues. But I think, as you pointed out, Hawkeye, it's by far the most common type of strain that we've got circulating right now, Kansas or Missouri.
And the second question that Donna has is similar. With the Delta variant all around us, how concerned are you for school in the fall, for the children who can't be vaccinated and for the teachers?
What do you think, Hawk? I think if you're vaccinated, you're safe, and if you're not, wear a mask.
Yeah, I think for those adults in the school system, the administrators, the certified people, the teachers, all those adults that had the ability to get the vaccine early on and got it, they are going to be protected. If they have not get it, I would strongly recommend that they get it to avoid morbidity, to avoid illness, to avoid missed days of work, all of that. And again, I think I still do anticipate that we are going to probably hear in the next 6 or 7 or 8 weeks that younger children are going to be able to get it. That's complete speculation, but we know how the vaccine data analysis and collection has been expedited. I'm fairly certain it's going to be safe. So I think that probably right as school is starting or right before school starts, those younger children are going to be able to be vaccinated.
Okay,
we're good.
All right. Well, let's turn to the rest of our discussion. I'm going to turn first out here to the Olathe Fire Department Marshal, Fire Marshal Wassam, and ask you a couple of questions. I think there may be even a cool demonstration we're going to get to in a moment. First of all, thanks for joining us this morning. Before we get to that demonstration, though, tell us how COVID-19 has impacted the Olathe Fire Department here during the pandemic.
Sure thing, and thanks, Doctor. Good morning, everybody, from Olathe Fire Station number 6. Really, COVID affected us like many other organizations. We had to overcome challenges and find new ways to do things, new procedures, obviously new protective equipment. But really what we're proud of is it caused us to be innovative. You know, obviously everybody kept having fire and medical emergencies. We couldn't stop providing care. We're proud of the excellent care we provide. We had to keep doing that. So we came up with new ways and new programs that we could do to protect our citizens and visitors. So a few that we're really proud of, with schools shut down, we partnered our mobile integrated health unit with the school nurses, and we actually worked together to provide care for children that were at home because their schools were shut down or they were there doing remote schooling, often without parents. So really great that we could provide that care. Our integrated health unit also assisted with monitoring patients that had COVID, and we had some smartwatch technology, some smartphone technology where we could monitor those patients, make sure they were recovering properly, and maybe flag if they were going the wrong way. Some other things we had to do, obviously with public education, we couldn't get out and be in the schools and be in the public, so we did a lot with our public education programs. Really proud now that we've converted most of those to electronic and digital delivery, so we can either give them in person or at works, or we can give them from a fire station or fire administration. Gave us a lot of flexibility. And on top of that, with permitting and offering virtual inspections, we really continue to take care of folks in fire prevention as well. So a lot of great achievements. You know, it really forced us to be innovative and come up with new things. And for all the harm it did in our community, it actually helped us get a little better. So.
Well, Chief, thank you very much for that great work. And to you and your team and all of our fire and police out there, thank you very much for the outstanding work, especially during this difficult time of the pandemic. So with the 4th of July almost here, what worries you most about all that? Firecrackers going into houses, although right now it does is rain in Kansas City, so maybe that won't be as much of a problem, but assuming it's going to be a little drier. Or injuries from people shooting off their fireworks. Where's your concern lay?
Well, definitely all of the above. And, fireworks are a dangerous thing. I'd say locally, we do have more of a problem with injuries than we do fires, but we do have fires every year. Just a little bit of data from the National Fire Protection Association. They report across the U.S. we have an average of about 9,000 injuries each year and about 19,000 fires each year. A lot of those are grass fires, but we do have structure fires. We seem to have a couple every year about this time, and so we really worry about all of it. But injuries are, like I said, the most common thing we see here locally.
So Dr. Dhaval Bhavsar, who is the director of our burn unit, is here. We mentioned it earlier today. So talk to us a little bit, Doc, about some of the issues you're seeing up in the burn unit around this time of the year and the impact of fireworks.
So it's really the Christmas in July for our burn units across the country and including us. We see this every year. The extended weekend of the July 4th, we see lots and lots of injuries. Most of these injuries involve a curious kid getting too close to the fireworks they're enjoying, or a young adult, a male mostly, getting kind of too mischievous and wanting to be sure that that mortar that he is trying to kind of start goes off. It doesn't, starts to fire, light it again, and it goes off in his hand or just right next to him. And we see those devastating injuries every single year, be it sparklers or mortars or many other types of kind of fireworks. And young male, young female also, but more so male than female, most of those years.
It's interesting. I remember as a kid, I played with fireworks all the time, and I didn't have my kids do that. I was always a little scared of them, but I know it's such a darn big thing, and yet the damage can happen in just that split second, and you're stuck with that damage for the rest of your life.
Absolutely, and I think you said it so much right. So the reason for the damage is that, example, sparklers they burn at 1,200 degrees Fahrenheit. We don't use any kind of type of fire around us that goes that high. Hot water is usually 120, 130 kind of Fahrenheit setting, or the grills that we use probably at the highest 500. Some specialized grills can go up higher, but this 1,200 degrees Fahrenheit of the sparkler, it only needs a fraction of a second someone touching it, and it leads to a burn. Or a mortar that is going to be blast injury on top of the temperature or the high temperature it will have. Those kind of injuries would leave definitely a lifelong effect, if especially that's a mortar where they have a pan blown off. I've seen enough of it to say that, please avoid, don't be part of that statistics.
Yeah, that's just tough. You don't want to be a statistic on this one because it is so permanent. And what do you recommend for safety if people want to try and handle fireworks?
I think this year, so last year was very different, and then we expected it to be different because of the restrictions from the COVID pandemic. Most cities did not do their city fireworks, and because of that, most families ended up purchasing their own fireworks and then did it next to home. And most families, and many more families than usual, got involved. And we ended up seeing almost double the injuries last year. Our hope is this year there will be less of those restrictions and there will be fewer families doing it, and we end up seeing fewer injuries. But at the same time, the best is to be careful. If you're having your kids enjoy the fireworks, please make sure someone is monitoring, watching over them to be safe. If you are doing it, like using bottle rockets, mortars, or other more dangerous fireworks, make sure you are less risky. If it doesn't go off after lighting it first at once, please let it go. Just wait it out and use a new one. Don't try to light it again. Don't get close to it, because that's how we ended up seeing most of our injuries.
Chief, I think that this program is going to get a reputation about being where fun goes to die. We told everybody to wear a mask, stay home, and now we're telling you to be careful with all the fireworks. Chief, what do we do out there? How do we let people have fun and yet not die or lose part of your body doing something that's just a little dumb?
Yeah, well, we'll show you some of the dangers here in a second with even the most basic sparkler, but our top recommendation is just like what the doctor just said. Let's leave it to the professionals. A lot of great shows around the metro area and and across the country. Those folks go through a lot of trouble. They've got a lot of safeguards to keep themselves and the audience safe. So we recommend you go watch a professional show. In many areas around the metro, fireworks are illegal. So obviously we all know they still happen, but they are illegal to use in most cities, including Olathe.
Yeah, I call that Royal Stadium. That's where I go to it. So, okay, you got a pretty cool demonstration. This is the PG-13 or R, I guess, if you don't like any violence. PG-13, part of our program. We're not usually like that, but let's take a look.
Yeah, thanks, Doctor. So we're going to do a couple of demonstrations today. Like we talked about, just the most basic of sparklers. I know you probably can't see that very well, but a lot of folks think that these are very safe. They let their kids use them, but we're going to do 2 demonstrations. The first will be with a hot dog here that's meant to simulate the flesh of your skin or maybe a finger. We're going to light the sparkler, going to just ever so briefly touch it to the hot dog, and you'll see how quickly it burns. The second demonstration we'll do is we'll hold the sparkler up next to a shirt. These new synthetic clothes and shirts and pants that a lot of folks are wearing now will show just how quickly those can be affected by just a basic sparkler. So unless there are questions, I'll
let's
light
do it.
the first one up.
I want to watch the hot dog.
All right, let's make sure our lighter works here. All right, so just basic sparkler. I'm going to hold it here just in front of the hot dog, and we'll just touch it a second or less. So you can see already just that brief touch, the flesh of the hot dog is very charred. And even the piece that's already burned beyond the flame, we touch that, still hot enough to make a burn. The metal stays very hot.
Dr. Bhavsar,
So
this has got to be,
a few times here.
Yeah.
you got to be cringing as you watch this because this is somebody's coming to your emergency room having need help.
This is exactly how a lot of kids over this time get burn injuries. That they just are enjoying the sparkler, they end up touching the hot end, or just by mistake, kind of dropping at their feet, leg, on their pants. Yeah, this definitely. And then the worst part is, because it's so hot, it will lead to a very deep burn. It is not like a hot water burn that will be not as deep, or a sunburn, which will be not deep at all. This would be absolutely a deep burn.
Kids sometimes step on these with their feet.
Absolutely.
Yeah,
I might be speaking from experience.
You can't put this genie back in the bottle.
Box. Yep.
All right, Chief, what else you got?
Yeah, so first thing I'll mention here before I move on, and like someone just mentioned, really easy to step on these, and like I said, they stay hot. We recommend you put them in a metal pail full of water. Make sure they get down there and get cooled off.
And you have a fire extinguisher
So the
right there
second
in
one
case you
I'll
have
do here-
trouble.
Yep, absolutely. Got a fire prevention guy has to have a fire extinguisher.
Yeah, I like it.
Well, the second one we'll light here, this is a different type of sparkler. I think they call it a morning glory. It has a wood stick, so the metal stick doesn't get quite as hot, but you'll see these still burn really hot, and we're going to show what it'll do to a shirt here. Just get this lit.
So you're telling me that when I wear my cool polyester fishing shirts, I'm really not flame retardant here?
No, not flame retardant, and I think you'll see here that melts the fabric very quickly. You know, it may not light and burn, but what it's doing with this synthetic material, it's basically plastic.
Yep.
So, I think when we're done here, we can zoom in on it, and you'll see that it melts the plastic, and that molten plastic right around where the sparkler touches, that can actually end up on your skin and bind with your skin. So if that happens, you're making a trip to the burn center to get that plastic removed and take care of that burn. So, but like
Well,
you
I'm
can
not saying
see,
this does not look like fun.
Very quickly.
This definitely doesn't. And
Yeah.
again, over years, we have seen anywhere from 20 to 40 patients during this 4-day weekend, 3-day weekend time. Last year was the highest in the 10, 11 years that I have covered burn unit at KU, we had 42 patients last year.
Ouch.
It was just extensive.
Man, were you on call last year for the?
I was involved, yes.
Yeah, that's tough.
That is tough.
I hope you don't
Absolutely
have to
tough.
take call this weekend. That's going to be a big one.
Right, whoever will be
Yeah.
busy.
Okay. All right, Chief, was there another demonstration after that?
Those are the ones we had for today. I think maybe there was some video, some things we've done in the past. You know, the rain's not going
Okay.
to be too cooperative with other demonstrations here this morning, but
It's all right. Well, I understand there's an
those are the two we've
M80.
got.
I understand there's an M80 with a watermelon we're going to watch here. You guys ready? This is like, oh, that's not good.
Yes.
So just to say, Chief, that's got to, you get into an injury from an M80, that's like dynamite here. That's really devastating.
It'll do a lot of damage, and we've got a few things here just for demonstration and display. You know, what you're talking about with an M80 is something that looks similar to this. That's what was in the watermelon in the video that you just saw. So basic stuff, lots of folks have them. You can buy them around the country. These are illegal in the state of Kansas, along with bottle rockets. So, they're illegal for a reason. They're dangerous. They cause injuries. They cause destruction and fires. So, like I said, we really just hope you'll leave it to the professionals and be careful with the materials if you do choose to use them. And just be aware of the regulations wherever you might live. Talk to your local officials about what's legal and what's not legal in your city or your county where you live.
So MAT and other types of mortars, we see injuries from them very frequently. And those injuries will usually involve hands and then face or both. The worst injury I've seen is entire hand blown off in a young child who got access to his father's mortar kind of collection. And that is an injury that just will never be able to be repaired or fixed. And even not losing the hand entirely, but losing a finger or two, or having injury to all the way to the bone and tendons, those are definitely lifelong effects that people will live with. Even though it will happen 1 in 1,000, 1 in 10,000, it still is enough numbers that we end up seeing that every year we come out and talk about it to make sure people kind of see that as a serious possibilities and possibility for serious injury, and make sure hopefully we can reduce injuries in our own community. I'd be happy to see fewer patients over the July 4th weekend.
It's funny how we make excuses for this kind of things, but if I said to you, okay, you're inside, and now 1,000 of you are going to step outside, and one of you is going to die from lightning. It's going to happen to one of you. I don't know who it is, but one of you is going to die. How many people are going to step outside? Right? Not many. But we go out and we do this stuff with the fireworks all the time, and yet you see, as you say, you see all these injuries that come in. It can be pretty darn dangerous. Well, Chief, thank you. Doctor, thank you.
Thank you.
We're going to come back. We'll involve these guys in our conversation because, Jill, I bet there's some questions out there.
There are a couple. A lot of the questions this morning were over the J&J vaccine, but I think you covered that pretty thoroughly. LJ wants to know, however, how do you know if the COVID symptoms are allergy symptoms or the new variant?
Yeah, the only way you know is to get tested, Hawkeye, because COVID can present like an allergy or an allergy attack. So there's really no way to know other than getting tested. And just to make a comment, I think as masks have come off, at least in my patient population, we're getting routine sick calls we haven't had for over a year, and they're getting tested and they're negative. So people, the cold and flu, the junkiest stuff that we always get is out there. That summer cold, that's out there, and people are getting it. The problem is you don't know if you have COVID or not. You've got to still get tested, because if you're positive, how we respond to that is much different, because common cold doesn't cause death. COVID-19 and the Delta variant, on the other hand, as we've demonstrated here and in Springfield and across the globe, Delta variant is dangerous.
Yeah, absolutely. Again, the symptomatology really hasn't changed from the original circulating isolate back in 2020 till now. The symptoms really remain the same. It is difficult to tell. We know there are other common cough and cold viruses that are circulating. So the best way to be sure is just go get tested. And on top of that, get vaccinated if you haven't been vaccinated already. because we know that vaccination will also help reduce that whole spectrum of disease of coronavirus as well.
Yeah, it is so true. Okay.
Susan has a question for the
You could see it, but, yeah.
Susan has a question for the fire marshal. She wanted to know if we were so busy last year, were you really busy last year during the 4th?
Yeah, absolutely. You know, as talked about earlier, with no professional shows and people looking for something to do, lots more fireworks that we experienced as well. And we always have a lot of runs, a lot of calls this time of year, but definitely more when folks are stuck at home and don't have another option to go see. But this year, hopefully it's different. Lots of shows going on, and hopefully folks will get out and watch those and not do so much at home.
So, Dr. Bhavsar, do you pray for rain on the 4th of July?
Yes.
Yes.
I didn't want to be the party pooper, but like not in that sense. But again, I would rather have people enjoy it, be able to enjoy the kind of professional fireworks that CT sets up. I think I would like to do the same, but at the same time, I think if that's how we're going to reduce the injuries, I think rain would be okay.
So really, you mentioned this is Christmas in July for you, but really what you ought to be saying is, let it rain, let it rain, let it rain. Okay,
Yep.
next question.
All right, we're singing, yay.
Watch out.
Joe
Star Trek
says,
reference. Oh, just made one.
Joe says that she has a friend who is 25 years old, got the Pfizer shot later in the day, developed chest pain, ended up going to the hospital, and her friend had pleurisy. Is that a side effect of the shot?
Yeah, that's pretty fast to be from the shot, to be honest with you, Hawkeye. I mean, normally it takes a while to get the immune response, and certainly we're not going to discount anything, but and people from the shingle shot get all sorts of symptoms and other shots as well, so I don't know it's unique, but that would be rapid, just to say, that would be right. We know a lot more about the facts of the case before we can fully comment, I think.
Yeah.
And Gene says that he went to the Auschwitz exhibit and nobody was masked. He still wore his, and he's wondering on indoors, would you advise that people still wear their masks?
What do you think, Hawkeye? To mask or not to mask indoors? CDC or WHO?
Yeah.
What do you think?
I think people are very thoughtful in asking these questions, and just, again, understand your individual risk and what you are willing to tolerate. So first of all, get vaccinated. Second of all, if you can do things outdoors, do it. If you are doing things indoors and going to some of these events, then understand what you are willing to tolerate. So continue to distance, mask if it makes you feel more comfortable. Do those things that we've talked about, because at this point in time, you have to assume that probably not 100% of those people in those events are vaccinated. So I think if you go into that understanding that, and then you just understand what your tolerance of risk is.
So just to take on that, I think that's a great point. We've talked a lot about what is your personal risk assessment throughout this. And just because the CDC says you don't have to mask doesn't mean you don't have to mask. You can still fully mask. Also remember, if you're not been vaccinated, you're supposed to mask, right? That's the whole point of that. It doesn't say nobody needs to mask anymore. It says if you've not been vaccinated, you should mask. If you have been, you don't have to. And what I'm seeing for the most part is that nobody masks anywhere inside buildings and stores anymore, and yet our vaccination rate's not 100%. I'm just saying there's a problem here with the math.
And your answer is probably works for Gayla too, because she's concerned about going to the Royals game. With the Delta variant, and she wanted to know, should I mask if I go to the Royals game? And recently I went and I wore it when I was like around crowded people, and then I took it off.
All right, you probably made a good choice. That's what choice I would make. But just to remind ourselves that the Royals games are outside, and we know that outside transmission is a lot less common. Although the Delta variant may be, we don't know enough data, I don't think yet, Hawk, about the Delta variant being outside.
Yeah, exactly. It's still, as we've always said, would feel more comfortable outdoors. We know there's turbulent airflow at that point, so any virus or particles is going to be dispersed into very low concentrations. If you can still distance 6 feet or more, that's important. As these events open up for full seating, whether it's Arrowhead or the K or Sporting, you're going to be around more people, but it is much less risk. And again, if you feel more comfortable, then certainly mask.
Dr. Bhavsar, do you still mask in the operating room?
I will not be allowed to operate without that.
Yes, because it keeps who safe?
Correct.
Keeps the patient safe.
Patient safe.
Yeah, we've got to
Yes.
remember, masks are not a new thing.
Yeah.
And Andy gets our last question today because I think we're running out of time. And essentially, she wants to know, she's going to be around family in a month. She gets her first shot of her vaccine and is, I think, asking, should she cheat and get the second one at 2 weeks because she's worried about having more time to build immunity, or just do the way it's directed at 3 weeks, 1 week before she sees this big group of family?
Well, first, thanks for getting your shot. That's the right thing to do. Hawk, I think we got to stick to the program, because really thinking you're going to get that second shot early may not help you as much as you need it to.
Yeah, exactly. We know that those first doses of the mRNA vaccines do offer protection, although not as great as fully vaccinated, which is 2 weeks after the second dose. But I would in no circumstances push up that schedule. If anything, you may be better off even lengthening that schedule from either that 3 or 4 week second dose, depending on what company you are getting your mRNA vaccine from. But I think the best recommendation is to stick to the scheduled dosing regimen.
Yep. All right. So, hey, tomorrow we hear from our chief medical officers. They've been checking in with us throughout this pandemic. And tomorrow, Dr. Larry Botts from Advent Health, Dr. Raghu Adega from Liberty Health, and Dr. Mark Steele with Truman Medical Center's University Health will be joining us in the program. It's always a pleasure to have those guys on here, kind of figure out what's going on around the city. We think there's been a little bit of an uptick, but let's see what's going on with their hospitals as well. And we'll all come together and talk about, I'm sure, all things Delta variant as well as vaccination, J&J, mRNA, etc. We're going to find out how they're also sitting going into the holiday weekend. Let's go around the horn today with final thoughts. Chief, I'm going to turn to you first. Thanks again for being on the program. Thanks to you and your team for all the great work that you do and the way you save lives every day. Final thoughts for today.
Sure, and thanks a lot for having us. Really, we'll just reiterate, be safe, go watch a professional show. If you have to use fireworks, we urge you to follow the instructions. Don't throw or hold the materials. Don't make your own. Those are incredibly dangerous. Don't use homemade fireworks, and dispose of them properly. So just be safe, everybody.
All right, and so Mr. Christmas in July, the weather outside is frightful. The fireworks, that makes them quietful. That was terrible. Final thoughts for today.
No, and happy Independence Day. I know that we all will enjoy it. Be safe. Be safe around fireworks. Be safe around grills. Don't mix alcohol and any type of fires.
Yeah, my daughter could tell a story. One time I was at a campfire with her, and I wanted to see how much isopropyl alcohol would burn. And you know what? It burns. What do you know about that?
Oh, definitely there are some really. My daughter would kind of make me kind of not say this, but there are cool YouTube videos where young kids have tried to see what it does to their skin when they would put rubbing alcohol on their skin and burn, and for sure it burns.
Yeah, not good, right?
There was some challenge going on at some point, and I think the kids have had some burns. We have treated some here years back. So yeah, please don't mix any type of alcohol in that case, and fire. It does burn.
And just to say, we said a big thank you to the fire marshal. We need to thank a big thank you to the Burnett Burn Center. These guys and Dr. Bhavsar is one of our leaders there. I grew up here as a pulmonary doc and worked for years over in the burn unit and taking care of patients. And I just think that's one of the hardest things to do. And you know, when you get a significant burn, man, that is everybody, all hands on deck. These guys do an amazing job. So thank you. And thanks for your advice from both of you this morning. Hawkeye, final thoughts.
Yeah, be safe. Hopefully everybody can be with their loved ones. And as we heard yesterday on the show, some of our elderly loved ones who may have been more isolated this past year. I think Dr. Bhavsar gave some of the best advice I've heard on this whole year and a half is don't mix fireworks and alcohol. That is very sage advice for sure. Dr. Bhavsar is an excellent, thoughtful burn surgeon. We've worked several times. You know, infection risk is major. When you have a disruption of the skin, one of the body's largest organs. So we work together a lot, but he always does his best, and patients usually come out on the right end with that. But protect yourself so you don't get in that position. And again, continue to go out and get vaccinated. as we showed here early on in the show, the Delta variant has become probably the largest proportion of the prevalent variants circulating in Kansas and Missouri now. Springfield is going through some hard times. We don't want to go through that in our Kansas City community, so continue to encourage vaccination to all of those who've not been vaccinated yet.
So a special heads off and thank you again to Dr. Dhaval Bhavsar, our director of our medical director of the burn unit, and Fire Marshal Assistant Chief of Community Risk Reduction, Mark Wassam. You guys, thanks for being on the program. Hawkeye, of course, we can't wait for you to get back here in the studio so I can mess with you some more. And to all of our listeners out there, I know it feels like you get tired of hearing from us, and now we're talking about the Delta variant and things could still go on. You know what? Just like what we're telling you on the 4th of July, make good choices. Because making good choices brings tomorrow to you in a way that you can enjoy it as opposed to suffering. So don't make the bad choice. You know what the good choices are. We've told you for a long time ago, BKC. So take care of yourself, take care of the people you love, whether it's on the 4th of July and you're dealing with fireworks or wearing a mask in order to stay safe. We'll see you tomorrow.